If you are a student nurse currently schooling in Nigeria and you are looking forward to writing the May 2026 examination under Nmcn to becoming a registered nurse, you are welcome. This video is for you. I'm Nurse Jonathan Nzebuka, and today we are going to be discussing something that you will need within the next 60 days. How to pass your Nmcn examination in the next 60 days. You're going to be getting some tips. But before we proceed, I want to encourage you to subscribe to our channel, Alpha Meg Nurse Tutors. Hit the subscribe button, hit the like button, and share this video to your friends who are also preparing for this examination. Let's dive right into it. Number 1, stop reading everything. Nmcn actually repeats questions and repeats some courses they focus on. Yes. Now here are some courses that they repeat questions on. We have Med-Surg nursing. In fact, this one is very big. You could say this is the biggest area they focus on, and you will know why. Obstetrics and midwifery. Yes, they set questions, some questions on obstetrics and midwifery. We'll talk about the topic specifically under that in a bit. Pharmacology. Know your drug interaction, drug calculation. Know your, side effects. Indications, contraindications, as well as medical management and nursing management, how you come into pharmacology area. Nursing procedures, yes. How you carry out certain procedures, they ask you certain questions, yes, especially during practical. So you need to read your nursing procedures well. And practice, it's more about practicing than even reading. Community health, yes, they ask questions, community health. And anatomy and physiology. Literally, that is the foundation of it all. If you do not understand how the human body functions, where they are located and what they do, how do you plan on knowing how to come in as a nurse in certain situations? It's very important for you to keep this in mind. But there are high-yield topics, except the courses, topics that they repeat questions on, that usually carry more focus. So let's just say more attention. We have the likes of shock. Yes, no shock. Hypertension, diabetes, preeclampsia and eclampsia. Now, this is where we talk about the obstetrics and midwifery part. Yes, you need to know this preeclampsia and eclampsia falls under abnormal midwifery. All right, but still, you need to know the normal midwifery as well as every other thing in it. Postpartum hemorrhage too falls under that. Exactly. Infection control, drug calculation, IV therapy, and labor stages. Take note of this topic, especially for those of you that want to go and read now on them. These courses are the courses, at least if you don't know where to start, within the next 30 days, focus on them. Yeah. So you see, you need to know one thing for sure. Nmcn will not ask you question on everything. No. Besides, how many questions are they setting for you? 500. Day 1, 250, day 2, 250. That's CBT based, right? Then you have your OSCE and the rest. So there's no need for you to stress. All right? But there's still more. But before we go to the second tip for day, if you are enjoying this video and you're finding this informative, why don't you click share to your class groups, your course mates, those of you that will be sitting for this exam, share to your friends, and hit the subscribe button. Please subscribe and like this video so that we are going to be able to do more for you. Let's go on. The second tip is to practice questions every day. This cannot be overly emphasized, because if you are just reading, it is dangerous. Reading alone is dangerous. So if you want success as you are reading, you have to practice questions. Now, the kind of questions Nmcn will test you on is not question that is about cramming. No, they don't test you on not cramming. We are testing on, or will I say Nmcn, test on application. The things that you've read, how are you going to apply it in practice? They test on that. Yes. So here's your minimum target. If you don't know how many questions that you want to practice every day from now till the day of your exam, here's the target for you. Practice between 50 to 100 questions every single day. Yes. Now, why are you doing this? Because doing this, practicing questions is going to train your critical thinking. Yes, you're going to be thinking fast, thinking well, thinking deep. And you're going to be becoming familiar with the questions, question familiarity, and you're going to be fast. The more you do something, the more your muscle, your brain becomes stronger and adapts to that thing, and it makes you faster. Remember, during the exam, you literally have either 3 hours or less than 3 hours to answer your 250 questions on those days. So if you have not been practicing questions, you have to start now so that you'll be fast enough on that day and you're going to be answering accurately. The third tip, read with a nurse's mindset, not a student mindset. Very important. Read with a nurse's mindset. Okay, don't still look at it like, oh, they'll ask me. No. Besides, the license that you're going to be given is a license of a registered nurse. You're going to be a registered nurse. You're going to be handling individuals. They are not going to be treating you like a student. All right? Now you have a responsibility. So it means that before you could qualify, we have to test you well. So always ask these following questions. What will kill this patient first? What should the nurse do first? And what is the priority? Yes, know these three questions. Now, why you should know these things? Because Nmcn loves priority questions. Now, pay attention to the following keywords whenever you're writing your exam or you're practicing question. First, immediate, priority, and initial. Yes, there are some, you see, they might speak a lot of jargon in the question, but there are some keywords that is going to give you a hint as to what they are looking for. So that keyword, like first, immediate, priority, and initial, and the likes of such, will give you hints on how you can be able to answer correctly. The fourth tip, you have to master your nursing procedure. Now, this one has to do with your OSCE. Master nursing procedure. This is where some students fail, unfortunately. It's not only about reading, practicing questions. Have you been practicing? Now, here are the things you can focus on. All right? IV cannulation, injection sites, intramuscular, intravenous, subcutaneous, interdermal, you have to know them. Wound dressing, in fact, if you ever got into nursing and from 200 or 300 level, you never heard about wound dressing, we have to ask you certain questions. You must know wound dressing. Yes, practice, go to the ward, go and practice, or go to your practice area and practice. Go and meet your lecturers, your tutors, your teachers, your friends that are good at this to teach you. As you read from the procedure manual, you are practicing. Oxygen therapy, important. Catheterization, important. Especially the length of these, catheters. You need to know the tubes. You need to know. All right. Remember, the ureter, yeah, it's urethra, not ureters, okay? The urethra in men and women are literally different in length. And so also the catheters used for them. So you need to know all these things, as well as the different sizes and all. The bags too, you need to know how you place the bags to avoid infection, returning back of the urine and a lot of things. You have to know them. And you have drug administration rights. Yes. The right person, the right time, the right dose, all the 5 rights, you need to know them. Now, you need to remember that Nmcn tests safety heavily. We don't need you to come and cause chaos. All right? So you need to, that's what they will focus on. Are you safe? Are you careful? That's the reason whenever you are carrying out if you notice, if you've ever had form of OSCE examinations in your nursing school, before getting to this point, you'll notice that your lecturers or your invigilators, supervisors, what have you, are always keen on seeing if you followed every single step. You wash your hands, you seek consent, you explain what you want to do, you provide privacy, you done this, done that, are you neat? Did you, turn off the fan when carrying out certain procedures like, bed making? Yes, very important. Good. Now, here's the 5th tip. Study 4 to 6 hours daily for 60 days. With structure, actually, 4 to 6 hours every day. Because you literally have 60 days, approximately 2 months to be ready before me. Now, we're not talking about you should just read randomly. Example, here's a structure. In the morning, you can read between 2 hours, theory. In the afternoon, 2 hours, you're answering questions. In the night, 1 to 2 hours, you are doing revision. Now, when you are consistent, you will realize that consistency beats motivation. It's not when somebody will come and tell you something and you'll be like, oh my God, I need to read, I need to study. No, we don't do that here. When you're consistent, you have a higher chance of passing than when you rely on motivation. Here's the 6th tip. Use past questions strategically. Don't just start practicing anyhow. Past question reveals Nmcn pattern, repeated questions and questions. That's why if you see some questions you're practicing, be like, is it that they ran out of questions? No. There are some questions they repeat. Don't just read the answers. Please understand why those were why the answers that you got were the answers. That's what we call rationale. Why is this the answer? Sometimes you ask a question and be like, I thought I'm correct. No, please try to practice, read, browse, research. Why is this the cause of this? Why is this the procedure for this? Why is this the correct action or the initial action for this instead of this? You get an answer for that. Especially in the age of artificial intelligence and the age of internet, you have no excuse. Do something. The 7th tip: fix your weak areas early. Don't avoid difficult topics like pharmacology. You see pharmacology, I don't know drug calculation, I don't know medication. No, please. Don't avoid them. Start. Now, here's a tip for how you're going to, understand your pharmacology. Understand the disorders. When you read disorders, look for medications or clinical, medical interventions that is carried out, or medical therapy that's carried out with those medications to target those, disorders. It will give you a hint. It will help you out. ECG, do not avoid ECG. The basics, at least. Do not. The QPRST, do not. Please. Repolarization, depolarization, don't avoid it. Go and read. Fluid and electrolytes. There's so much for me to know. No, there is no excuse. Go and read. See, the reason why most students fail is because some students avoid the weak areas, and shockingly, it may be that weak area you will meet in your exam. So do something about it. Here is the 8th tip. Study like your license depends on it. Because it does. Study like your license depends on it. Because if you fail, you can't get a license. If you fail, you are not, even if you are done with school and you fail, the simple truth is that you are not acknowledged as a registered nurse. You are not acknowledged by Nmcn. You are still a student nurse. All right? So, you see, your exam determines your career. It determines your license. It determines your future. So, take it seriously. And here's the 9th tip. The 9th tip is this: stop group reading that wastes time. If when you go to your group reading, you guys are gisting and gisting and gisting, you are gisting and you are gone, come back. Stop it. Many group students or many group studies turn into gists, distraction and noise. But when you are reading alone, it's often more effective. But if you were to read in groups, please choose individuals that are very serious. It will help you. Okay? Choose individuals that are serious, that want to pass this exam as much as you do. Don't go and gist. This is not time. We're not saying break friendships, no. But you should know your friends, because at the end of the day, if you are distracted, you guys are not helping each other. So lock in. All right? So now here's the 10th and final tip we're going to give you. Confidence is built from preparation. Yes, preparation. So how can you see, students who often fail, when a student fail, this is the kind of thing they say things like, I read or I read but not effectively. Students who pass say that I trained like the exam was tomorrow. So you are reading, lock in. I remember during my time before I became a registered nurse under Nmcn, we were locked in. The way we had group classes, we had tutorials, we were locked in. Even when I was on my own, I tried to lock in, because we are aware we don't want to, disappoint ourselves. Do not let yourself be the reason why you do not pass. As well as while the CBT center, the invigilators, the supervisors do their own part to make sure that they are not your problem, please do not become your own problem. Now, here's something I want you to know. Nmcn is not passed by luck. You do not pass Nmcn exam by luck. All right? It is passed by preparation. So, if you can give yourself 60 good days of discipline, you can give yourself 30 years in your career. 60 days to become a registered nurse, a registered nurse under Nmcn for life. How about that? Can you do that? Or maybe until when you retire. So please lock in, okay? So if you enjoyed this video, once again, please share this video, share with your friends, and like this video. Comment if you enjoyed it. And yes, we are Alpha Megnos tutors. We offer classes. So if you need tutors in preparation for your Nmcn examination, or you want to join our group classes, please, why don't you send us a DM with the link in the comment section, or you click the link in the bio to redirect you for the payment for the group classes so you can join us. So see you in the next one.